It's not easy to talk about cancer, yet knowing your family's history of cancer is a first step to understanding your own risk and may qualify you for genetic testing that can inform your way forward. My Risk Hereditary Cancer Test with Risk Score from Myriad Genetics is a powerful tool to help healthcare providers identify your risk of developing 11 different types of hereditary cancer. And Risk Score analyzes multiple factors to estimate the risk of developing breast cancer over the next 5 years and remaining lifetime. Learn more about My Risk with Risk Score at getmyrisk.com.
Hi, I'm Dr. Aliabadi. If you struggle with irregular cycles, acne, facial hair, body hair loss, or insulin resistance, you might be dealing with PCOS or polycystic ovarian syndrome. Having dedicated my life to helping women with PCOS, I understand the challenges in getting an accurate diagnosis and the right care. That's why I created Ovi, a science-backed alternative to prescription medications. Ovi is designed to help you take control of your health with clinically proven, validated ingredients in a simple, once-a-day solution. For too long, women with PCOS have had to choose between lifelong prescriptions or complicated supplement regimens. Ovi offers a better way to help manage your symptoms without the hassle. It's my mission to empower women facing PCOS and other hormonal issues by providing the information and support they need. Reclaim your health once and for all. Go to ovi.com. That's ovii.com and start today. So, May is Melanoma Awareness Month, and I'm so honored to have one of my friends and colleagues here, Dr. Omid Hamid, who is one of the true pioneers in the field of oncology, specifically with melanoma. He helped me with my daughter scare years ago. Dr. Omid Hamid is not only one of my friends, but he's a very well-known melanoma specialist. I'm so excited to have you on our show. Welcome.
Thank you for inviting me, and it's a pleasure to sit here and talk about something that we've devoted a lot of time to. I trained at USC and then furthered my career going into drug development. I currently work at the Angeles Clinic and Research Institute, a Cedars-Sinai affiliate in Los Angeles, where my focus is patient care of patients with cutaneous malignancies, and also work with the phase 1 drug developmental program for patients who require novel therapies because they've exhausted standard therapies. My main focus and what I'm known for is the development of novel drugs, specifically in the field of immuno-oncology, and that is the development of therapeutics that leverage your own immune system against a tumor.
Well, I think it's interesting because I had always thought, and I think a lot of us until Khloe Kardashian came out and Teddy Mellencamp came out, melanoma was thought of I thought it was sort of an older disease that you really only got melanoma when you were a lot older, and we're seeing more and more and more young people get melanoma. We actually asked Khloe if it was okay, because you're Khloe's doctor and Teddy's doctor. We asked both of them if it would be okay if we talked about them on this podcast. And Khloe said, yes, please. She says, I really want to bring awareness to this because young women, especially young women who think they're exempt from this cancer. So
that's a great point. And melanoma is actually a malignancy of younger people. We all think about cancer as being something we get in our 6th or 7th decade, but melanoma can happen at a very, very young age. In fact, I have patients that come from the teens all the way to 80s, 90s, and a lot of it is due to environmental exposure that we can avoid. Most of our patients who show up have no idea about their lifestyle that led to this, their risk factors. There are genetic risk factors, some that overlap what you and I do. So BRCA2 mutants have a higher risk of melanoma. Melanoma has a higher incidence in younger women than younger men. And because of all of the work that's being done and the research that's being done, we have now great therapies for it. And they're not chemotherapies. They're therapies that hijack the cell's own mechanisms or utilize your own immune system to attack it. So we have made the greatest advances in the care of this tumor. The majority of skin cancers that dermatologists and others diagnose are non-melanomatous skin cancers. What is that? Basal cells and squamous cells. And they're in the older population, the sun exposed, and they can be taken care of with surgery, topicals, radiation. A very small component of that is melanoma. And then when you open up and you look at that, the majority of those melanomas are early melanomas, and those have like a 98% cure. So what does that tell me? It tells me if you have any risk factors, light skin, light eyes, family history, a genetic predisposition, a lot of sun exposure, that you need to be seeing your dermatologist often.
How much is often?
Depends on risk, but I would say that someone who has those features should be seeing a dermatologist.
Wow. So doing a full mole check?
A full check, a whole body check, everything. And that is a great way to avoid needing to get any further therapy. A small surgical procedure done in an office can be done by a surgical oncologist or a dermatologist to have that experience, whether it be with Mohs or a surgical oncologist that is expert at that.
What's Mohs?
Mohs is a procedure that is done by a trained dermatologist, and it was created to preserve cosmetic look and function. Instead of making a huge cut or making a surgical cut, they do what they call piecemeal stage cuts and then look at it under the microscope to make sure they've cleared the area. And for some, that's very important for lesions that are at places where cosmetically it can be deformative, or it can cause a lack of function, like around the eyelids, etc. And then, of course, in the other areas, there's a whole field of surgeries. If it's deep enough, the need to look at the lymph nodes. Melanoma sort of mimics breast cancer, and this is how I explain it to my patients. There is a lesion, a lump, something that is foreign in your body that's taken out, just like you do a lumpectomy. Depending on its size, its depth, its aggressiveness, then a sentinel lymph node procedure is done to look at if it's gone to the lymph nodes. Exactly. Then if it is advanced, we do scans to see if it has spread. If it has spread, then there's a whole other therapeutic paradigm. If it hasn't spread, then the whole discussion about therapeutics to prevent recurrence based on risk exists, just like in breast cancer. Now, in breast cancer, it's chemotherapy and or radiation and or hormonal therapies, all which have been shown to improve your ability to prevent recurrence and to live longer. And that's what we're doing now in melanoma. This is all the same paradigm, but a different diagnosis.
So what are the treatments for melanoma?
Well, so that's a great question. And it's very important here to point out that the therapeutics for melanoma have changed over the last 2 decades. In the past, this was a malignancy without significant therapies, without the ability to be controlled, and everything was experimental. This is a very immunogenic tumor. What does that mean? Your body sees it as being foreign in a similar fashion as it would see a virus or a bacteria as foreign, and can create an immune reaction that can cause these tumors to resolve. And we've seen this historically for hundreds of years with tumors that resolved after a viremia or a local injection of an irritant. And so immunotherapy in the form of checkpoint inhibitors, we'll discuss that later.
Yeah, you're going to have to break that down to me.
Has become the standard therapy for the majority of melanomas. In the metastatic setting, even in the most advanced setting of brain metastases,
Meaning that the melanoma went to the
melanoma
brain.
has moved to other parts of the body. As I tell patients, it's moved from where it began in Brooklyn and it's gone to Bronx and Manhattan.
Right.
And then it may go off the island into the brain and the other areas. And with proof of principle there, the whole paradigm is when you show that you can help people live longer, do better in that advanced setting, then it's now come into the setting of high risk of recurrence patients. So immunotherapy is one. And then by
Can you explain what immunotherapy is?
immunotherapy is the utilization of any therapy that can stimulate your inherent immune system.
Okay.
So in which ways? Historically, we've had cytokine therapies, interleukins, which is a big word to say those things that cause inflammation in your body. And these checkpoint inhibitors are novel drugs that have been, they're antibodies. They target connections between your immune system and the tumor that are negative connections. They dampen the immune response. They allow the immune response to flourish. Well, what are cancer cells? Cancer cells are just your normal body cells that have lost the ability to be controlled in their growth and their migration. They utilize those protective mechanisms as a cloaking system from the immune system, sort of like hiding from the cops.
Right.
So these drugs uninhibit the immune system. So that's one group of therapies. And then the other group of therapies is based on utilizing the genomic signature, the sequencing of the tumor. And that's not genetics like, I have blonde hair because my mom had blonde hair, or I have a risk of having breast cancer because this person had breast cancer. These are novel mutations that are caused by changes in our chromosome, whether it's from UV or they happen sporadically. There are subgroups of mutations that we are aware of that we can target with oral medications or IV medications, and that causes the shrinkage of tumors and the resolution of those tumors. So those are the two basic tenets of care in melanoma. So what is interesting about that, if you put the targeted stuff aside and explore the immunotherapeutic side, is that these drugs were developed in clinics like mine for melanoma have now revolutionized how we take care of any solid tumor,
That's amazing.
any liquid tumor. The drug that I'm very well known for working on together with other investigators is this drug Keytruda or pembrolizumab. It is a checkpoint inhibitor. It blocks one of those inhibition signals. And that now has over 40 indications. Well, melanoma is indicated for initial therapy of triple negative breast cancer, kidney cancer, lung cancer, both types, mesotheliomas, certain colon cancer, certain rectal cancers. And it has really changed what we do. So for me, my career began just at the beginning lights of that type of therapy. So it's been extremely fulfilling, and for our patients has really changed their outcome. Before the advent of this type of therapy, the average survival of a patient with metastatic melanoma was 6 to 8 months. So take 100 patients, and by 8 months, half of them had succumbed to the disease. That's a very poor outcome.
Yeah.
One of the worst. And at this time, 10-year data that have been compiled on these checkpoint inhibitors show the average survival is 6 years. Okay? So
Significant.
significant. 8 months, 72 months.
Yeah.
And what the other hallmark of this therapy is, it's not directly working the drug. The drug is informing your immune system. So if it works and you have a stability or a benefit, at some point it plateaus and the patient has a above 95% long-term survival. And that's data that was just published in the 10 years of this type of treatment.
Just going to the basics for me, genetic testing is very important. As you mentioned, BRCA2 patients are at a higher risk of having melanoma. there's P10 mutation, there's the TP53, and then the main one is the P16 gene mutation, which is the CDKN24, which I do regularly. I do the Myriad Mirus genetic test on my patients. Even patients with pancreatic cancer, family history of pancreatic cancer, ovarian cancer, breast cancer. So I just want to make sure our listeners understand that you don't have to have a family history of melanoma.
That's right.
If you have family history of breast cancer, pancreatic cancer, ovarian cancer, or melanoma, I recommend the Mirus test. And I was reading that with the P16 gene mutation, you're 50 times more likely to get melanoma, which is
so
really
these
significant.
are things that, so here's a thing. If you know your risk, how can you prevent that outcome?
There's something about the start of summer that makes me want to hit reset. Longer days, more energy. It feels like the perfect time to check in with my routine and see what's actually making me feel my best. This summer, I'm going to try meditation. I've tried my entire life, and I've decided this is the summer of calm. I also have been trying Symbiotica. They make a clean, powerful supplement that helps you feel good from the inside out. Whether your goal is glowing skin, more energy, or better digestion, Symbiotica has all of this for you. One of my favorites is their liposomal vitamin C. It's packed with ingredients that support collagen production, skin health, and immunity. And the vanilla citrus flavor is really good. I take it first thing in the morning, and it's like giving my body a little boost to start the day. Right now, Symbiotica is making it even easier because Symbiotica is having a memorial sale right now. You can grab all of these 25% off plus free shipping. I'm already stocking up. So if you've been thinking about trying them or just need a reason to refill your favorites, hurry to symbiotica.com/SheMD. That's CYMBiotika.com/SheMD. For 25% off plus free shipping, trust me, your body will thank you. The grocery store gives me pure anxiety. I walk up and down the aisles, and it's just so confusing. You don't know what to believe. Some of the companies have such good marketing, and when you really dig down into the ingredients list, you see that it's really filled with junk and things that are bad for you. That's what makes me excited about Purely Elizabeth. Purely Elizabeth makes delicious granolas, oatmeals, and cereals, intentionally crafted with superfood ingredients. The founder, Elizabeth, is a certified holistic nutrition counselor and health coach who believes it's possible for healthy foods to be enjoyable. And let me tell you, Purely Elizabeth's granola with crunchy clusters, ancient grains, and superfoods is exactly that. I eat this granola straight out of the bag. My kids even love it, and it's really hard for me to get them to eat things that are both tasty and good for them. Purely Elizabeth has a ton of granola flavors to choose from, like chocolate sea salt, blueberry hemp, vanilla almond butter, and my personal favorite, the original ancient grain granola. Everything is gluten-free, vegan, non-GMO, and made with ingredients you can pronounce. It's snackable, satisfying, and a little bit of a life upgrade. I even keep it in my car for a quick snack. Go to purelyelizabeth.com and use code SheMD at checkout for 20% off your order. That's purelyelizabeth.com, code SheMD. Purely Elizabeth. Taste the obsession. Eating disorders are serious medical conditions, and they're much more common than you think. My friends and I talk a lot about how when we were growing up, so many of our friends and family members had eating disorders, and no one talked about it. We all felt ashamed, and a lot of people didn't get the help that they need. I'm so thankful that that's no longer the case. Equip is a virtual, evidence-based eating disorder treatment program that helps you or your loved ones heal your relationship with food. Each person has access to a dedicated care team that can include a therapist, a dietitian, a meal provider, and peer and family mentors to help you achieve lasting recovery. Equip is covered by insurance, treats people of all ages, and has no wait list. Their approach is designed to make treatment more accessible and tailored to individual needs. Equip emphasizes the role of family in recovery, providing education and support. to help loved ones understand and assist in the healing process. Their platform allows for regular check-ins as needed. Anxiety around mealtimes, feeling out of control around food, or extreme picky eating could all be signs of an eating disorder. If you think you or a loved one could be struggling with an eating disorder, Equip can help you achieve lasting recovery. Visit equip.health/SheMD to learn more. That's equip.health/SheMD.
We still haven't proven that, doing imaging or doing anything is preventing long-term issues. I know that the most important thing is to get back and really do a quick check on your family.
Yes.
And then seek the right people who can take care of you. We live in a time where every person can have their own virtual group, no matter where it exists, to ensure that they have the best outcome.
And I just want to say that the cost out of pocket, most of the time insurance will cover these genetic tests, but the cost out of pocket is $249. So I think if you have it, if you don't have insurance, I think it's worth doing these genetic tests. But I wanted to ask you a question because years ago, it was I had a Christmas party at my house, and when everyone left, one of my relatives was sitting there, even though it was winter, he was wearing shorts. And I saw a little lesion on his leg, and I'm like, that looks, the lesion is irregular, it's raised, it's darker brown. I'm like, has this been there? He's like, oh yeah, I've had it for years. I'm like, is it growing? He's like, yeah, it's been growing. At this point, it was the size of a dime. So I remember it was 11 o'clock at night on a Sunday night. And I said, you and I are going to my office. So I brought him to my office. I numbed his skin and I used the cervical punch biopsy.
That's right. It's the same thing.
Same thing. I didn't care at that point. I punched it out and he came back melanoma. And luckily, his sentinel lymph nodes were negative. But I was just so surprised. Someone educated like him, he must have been in his late 40s at the time. He was completely clueless of this lesion right in front of his eyes, growing with irregular borders with dark brown. So my question to you is, what are the early signs of melanoma that doctors or patients can look out for?
Okay. So I'm going to back up again and say this, that there are many different types of melanoma, and there is no group of people who are inoculated against it. Oh, I'm from the Middle East. I have dark skin. Nope. I can't tell you how many Middle Easterns are taken care of with cutaneous melanoma skin. When you talk about the Black population, they have a higher risk of acral mucosals. Acral is palms and soles. And clearly it's important. Black women have a worse outcome. The Black population is diagnosed at a more advanced stage than any other population. So let's get back on what would key you to be concerned. So any lesion on your body, anything that is changing, whether it's spreading, the borders are irregular, so you're looking for the asymmetry, that the borders don't look the same, the color is changing, so it's not just one color, it's multiple colors, the diameter is getting longer, that it's going from something that is growing outwards, so horizontally, to something vertically. Something vertically growing is a huge indication of a malignant transformation. Bleeding, itching, and then there are melanomas that are amelanotic melanomas, that they don't have that darkness, that they may look like something else. So I would say, if you're seeing something on your skin that's new, you need to talk to someone. If it's growing.
Yeah, my friend's mom had something that just looked like a freckle under her fingernail.
Oh, you told me.
And it looked like a freckle. All of a sudden, one day she had a freckle, and nobody thought anything. And
it's the subunguals.
Yeah, and then she ended up dying.
And they look and they say like, "Oh, I must have hit it somewhere," or I can't tell you how many people I see that have something under the nail. Subungual melanomas do exist, and they're hard to treat.
And then what about? I'm always in my dermatologist blowing off these little scratchy, like raisy things on my face.
Yeah.
I have really light skin, and so I'm an Irish lass, but they're constantly like zapping these things off.
That's right. So is everything on your body a melanoma? No. Our majority of risk comes from our sun exposure as we're young. That skin ages and you get things like lots of dysplastic nevi, just normal moles. Cherry angiomata, those things that are red, they look like cherries.
Yeah.
They can break off and bleed. Actinic keratoses. All of us have a more elder person in our family that has the things that look like a wart but colored. It looks like you can just pick them off.
Yep.
Anything questionable,
Just go.
just goes to see somebody.
I have to share my daughter's story because when she was 10, she had a lesion on her lower back. I sent her to a very well-known dermatologist in our town, and my husband came back and he said, no, he said she's fine. It doesn't need to be biopsied. I'm like, no, I don't like it. It's growing. It has irregular borders.
Right.
She was 10 years old. So I told my husband to go back. I called the dermatologist. I'm like, there are two options. Either you do it or I have to take my daughter to my office and do a punch biopsy on a 10-year-old. I think it's going to affect our relationship because she's going to scream her head off. And he told me, he's like, what are you worried about? I said, well, one of my relatives on my husband's side had melanoma that I diagnosed. I'm just worried. He told me the chance of this lesion on my daughter's skin, the chances of it being a melanoma was like if my daughter was walking on the street and a grand piano fell on her head. And I'm like, you know what? I don't care. I want it biopsied.
Yeah.
They biopsy it. I don't hear back. Nothing. So I assumed everything's good. 6 weeks later, I get a call back saying, we need to talk to both of you because this could be an early sign of melanoma. But that's when I called you and you got involved and we sent it to another lab. We sent it so many places until they said, well, no, but it could be confused at their age. The reason I'm bringing this up is if you see something growing, abnormal, irregular, even if it's on your child, you have to be their own advocate. You have to be your own health advocate and you have to question it. And if someone dismisses you, it's important to, like you said, find the right doctor. In my office, any lesion on the labia, on the vulva,
Yes.
any lesion gets biopsied. Any lesion. I don't, especially if it's darker color, there's no reason to risk it. It takes 1 minute to biopsy a lesion.
And most people think, oh, it's that area. It doesn't get sun.
I was going to
should
ask you
not
about
happen.
that. Does the vagina ever get a melanoma?
Right. So there, yes, there can be in sun exposed area, unexposed area. Let's get back into a different type of a melanoma, mucosal melanomas that exist. They occur in your mucosa. So people say, where is that? But this is those cells that come from your neural crest. While you're an embryo, they go multiple places. And in the mucosa, you have these cells. So you can have a nasal mucosal melanoma. You can have an oral mucosal melanoma. The whole gut has that mucosa. And so there's a lot of rectal and vaginal mucosal. So any type of bleeding, spotting, etc. Most of these anal mucosals are diagnosed as, oh, I think I have a hemorrhoid and it's been bleeding for a long time. And then on pathology, they're diagnosed. Also, there are labial melanomas that exist. Those are skin melanomas. They respond like skin melanomas. If you leave something like that, there can be a lot of deformity, a huge amount of surgery, and pain. But the goal is to say almost anything, any symptom globally in medicine needs to be explored. I'm not saying become a hypochondriac.
Right. No, but anything
But
that
I'm saying anything
shows
that
up and looks weird
and
should
sticks
take seriously.
around. Okay.
So you were Khloe Kardashian's doctor, and she's given us permission to talk about this with you today because she wants to bring awareness, especially for young girls. What did it start off? Was it a mole? What was the sign that she thought something was wrong?
Well, she saw something that was a growth that she recognized as being new.
Right.
And that was there and didn't go away. So she did the right thing, right? So this is something, it was very visible, so she caught it early and it didn't go away. And then she sought care. And that care gave her the ability to have it diagnosed early.
Did you diagnose it?
No.
No.
Okay.
And to have an expert surgical procedure that left her without deformity. And what we have now is you'd be surprised at how well things heal. And after many years, they're not even visible, a scar.
Her skin looks amazing.
I mean, it's
You
incredible.
can't even see it.
So
That's
what was her treatment then? So was it immunology, or
No,
it was literally
she-
just take it? It was early enough.
Was early enough to have it taken out. There was some concerns about what it looked like, so we sent for multiple opinions, and after a while decided that this was one where we did surveillance. And surveillance is a part of treatment for early melanoma. Now, it's very interesting with melanoma because we gauge it by millimeters. And if you have a specific millimeter without even lymph nodes, your risk may be greater than having a much thinner melanoma with a lymph node involved. So I'm grateful that it was caught early. We did the surveillance, and she's continuing surveillance now with her dermatologist.
Will she have to do surveillance for the rest of her life?
Yes, there are multiple points to be made here. Let's go back to Thaïs' story about her family member. If you have a family member with melanoma, you have an increased chance of having a melanoma yourself. Okay, even if you've never been in the sun, you have a higher chance yourself.
Right.
Okay, if you've been like me and you've exposed yourself
Right.
to this toxin, which is the sun, then you have a higher risk. And if you yourself have had a melanoma, you have a higher risk.
And when you're treating that same, again, young girl sees something that's odd, comes in, she has melanoma, which is a shock. I mean, anytime you have cancer, I think it's a shock, but especially if it's a young girl. When you're doing the surgery, you go in and can you see the melanoma?
Well, let me be clear. I'm not a surgeon.
Okay.
Usually what happens is an initial biopsy. That biopsy will tell you if it's transected it through the tumor, or it's caught it at a place where it's negative. But that's not enough. Even if that punch biopsy that Thaïs does gets all of it, there is a need to get clear margins. And those margins are significant. Okay, that has to be done in order to prevent something that's important for the face, local recurrence.
Right. And clear margins mean you have to cut more
Around,
than the tumor.
more around
Significant.
Yeah.
It's significant.
Yeah.
But because of all of the advancement made in surgical care of this malignancy, these patients do so well. The cosmetic outcome is so great.
She's
And-
so beautiful. I mean, it's just, and her skin is flawless now, which is great I'm so happy that she came out and said, hey, this is what I have. So it was really amazing that she did that.
There is a huge amount of advocacy that can come from an experience, just like Thaïs has done and others have done.
And I sat next to Teddy Mellencamp at this, actually it was a breast cancer dinner the other night, and she had, shaved her head, and she's been in the news a lot because of this, and she has stage 4, and she's so gorgeous, and you look at her and she's sick and she's fighting, she's been very out there. I know you're her doctor, and she's given us permission to talk to you about this. Can you talk to us about stage 4 versus what Khloe had and how?
Right. So the staging of almost every cancer is the same, and I'll just describe it for melanoma. There are 4 stages, 1, 2, 3, 4. 4 is metastatic. It's left the local area, as I said, it's moved.
Right.
It's called local regional. So it's involvement of lymph nodes. Or in melanoma, you have these things called in transit. So between the area where the melanoma begins and the lymph nodal station, there can pop up little things in the skin. That's stage 3, local regional. It's not in the initial area.
Right.
And then stage 1 and 2 deals with the depth of that lesion, and one of the poorer prognostic things that you can see with melanoma, which is ulceration. So those melanomas that are most aggressive ulcerate. You see an ulcer either under the microscope or when you see it. Those are the ones that bleed.
Right.
So she has stage 4.
Did it start with a mole and then then by the time she figured it out, it was already
Very interesting that she had a lot of very early melanomas that occurred in her back up by her right shoulder.
Yeah, she's shown the pictures. I mean,
And those pictures are available
yeah,
actually
yeah.
on her Instagram. And this came from either a sunburn or something that created that damage. Now, here's a very important point to make. Not just about melanoma, but every other cancer. Melanoma is a field defect. If you've been in the sun and you've been tanning, just because you get the melanoma here doesn't mean that there isn't risk everywhere. Just means that that carcinogen, that toxin there with other things caused that one cell to change. So you have a risk of other areas doing that. What's a more traditional way to think about it? People who smoke, okay? The belief is, oh, I smoked and I got the lung cancer there. That's where smoke goes in the lung. Not truly. That smoke gets picked up by your whole gut, so you can get upper gastrointestinal cancers. It gets excreted in your bladder cancers from smoking, a whole host of other things from this toxin throughout your body. Your biggest organ is your skin. And that's the concern here.
So with Teddy, so she had it in her back and then got it taken out. I mean, you could see the scars and all of that. And then she kept going back to the doctor and then it metastasized and then it.
She was being surveilled appropriately.
Right.
And ultimately, at one point, we received a phone call that she had had a bad headache for an extended period of time. And that she had shown up in an emergency room at one of these outside hospitals. And they have done a CAT scan and it showed significant disease. The melanoma had gone into her brain and had caused a lot of swelling, some bleeding. And that's when we got involved and brought her over to Cedars-Sinai Medical Center. And we activated the group of doctors who works with us to take care of our patients. Initially, she needed a neurosurgeon because these things were so big that she needed steroids to decrease the swelling. Well, steroids work negatively against your immune system. So we got those things taken out. She was seen by a radiation doctor, a very lovely guy that we know. And Dr. Merhadi made a plan for radiation.
He's amazing.
Extremely well trained. And interestingly, we could give all of that, take her off the steroids, and began her on immunotherapy. And in fact, on combination immune checkpoint inhibitors. And those have, in trials that we did with other centers, shown a phenomenal response. Amazing. What does that mean? Well, in the past, if you had that much in your brain, there was nothing that worked. Right. And within months, you would have unfortunately succumbed to the disease. And now there is long-term survival.
Even with stage 4.
Well, with stage 4 and even with brain metastases, the hardest to treat.
Right.
And I'm very fortunate to be part of that team of physicians who took care of her. She came to the Angeles Clinic for her decision-making and her surgical therapeutics. She receives care with us and at the Cedars-Sinai Medical Center, where her radiation oncologists are, where she was interned to get her surgery, and where the neurosurgery group is. But that does not just exist at the places where I have privileges. It exists all over the nation, all over the world.
That's so hopeful. It's so hopeful because, like you said, it was a death sentence before, and now there's a lot of hope.
She is doing phenomenally.
Right.
And, my hope is at some point when we're out of the woods, that at some point that this whole story
Yeah.
will be there because it is a story of initial work that was done in many labs to identify these therapies, brought into the clinic and worked on with dosing, understanding the side effects, and then put into work with patients
Amazing.
and showed improvement and showed long-term benefit. I have people 10 years out plus, where it would have been 4 months, it's 10 years.
And what's this treatment called?
This is a combination of checkpoint inhibitors. So those are those drugs that release the suppression of the immune system. Guess what? Since her initial hospitalization, Teddy has not spent a day in the hospital. And if you follow her, you can see that she has been able to do her work. She has been able to be a mother. She has been able to be a partner.
I mean, she came to this event.
Yeah. So the treatment was checkpoint inhibitors and
Right.
anything
There's
else? Or
two
is that
drugs. They're
okay.
both. It's called Opdivo and Yervoy. But these are the drugs that I'm telling you are being used in multiple other cancers, and we're now working to add other things on. So we may be a little bit behind than other tumors because in the past, what did you find? You found one chemotherapy that worked, and you added another one, and you added another one. You know, for breast cancer, even in the preventative setting, there are combinations of 3, and we are now at our place. So, big plug for places that do clinical trials, elucidating not just what's good now, but what works in the future. And now it's not just 2 drugs, it's triplets and quadruplets.
Oh, I love this.
And then
There's hope. There's hope. There's so
induction
much hope.
and maintenance. And there's a huge amount of hope. It's just a time where we had come to the point where we had the drugs that were tolerable to prove what we've always known.
Right.
That by utilizing your own
immune
body,
system.
your immune system, that you can create this setting where these tumors resolve.
I'm going to fire a few questions. First of all, for patients at high risk, let's say the ones with P16 gene mutation that have a very high likelihood of getting melanoma, is there something they can do, like a medication they can, use? Like, let's say for breast cancer, we give tamoxifen for 5 years to reduce that risk.
No,
is
we
there
don't
an option?
have that
We don't
yet.
have that.
They are looking at therapies, but we don't have that yet. The best thing to do is to get involved with a geneticist. Why? Because your whole family needs to be looked at. If you had a propensity to clot, then you would check it on your whole family.
Right.
Same with this. And then start with the right physicians who can do your surveillance. And
So that's prevention. Like if you were to say, to your point,
right.
if you have this gene or this family history, or even if you don't, what's the prevention measures? It's
that's right. Then
that's
you
what you're saying.
avoid things.
the sun,
tanning
beds.
but also a point that everyone asks me to make. It's not just when the sun's out that UV is out, okay? UV is out all the time.
I know.
So,
our whole life. We put baby oil on. Like we were out there baking in the sun.
tanning and having tan skin has a lot of positivity. It's associated with health.
And vitamin D.
Right. But let's answer that. You don't need to be out in the sun that much to get vitamin D. Okay, that's number 1. But there is a lot of data about UV and how it affects our body. Why? We all know this because there are people who are seasonal affective.
Right.
Why do they become depressed when the sun's not out? Well, there is some physiological data that shows that UV sets off a reaction that increases opioids in our blood. And it makes us feel better. And when you take that away, we don't feel as good. I work with a group, AIM at Melanoma, that's worked very hard to get tanning bed legislation.
Yeah.
And for a while, in certain places, if you went to a tanning salon, there was a cooling off period, right? You couldn't come back the next day. You could go once a week or something. Guess what happened? People had memberships at different salons. So this is a habit that we need to break.
I've really come to believe that aging isn't something to fight. It's something to understand, to embrace with intention, because it's not about trying to look 22 forever. It's about showing up in your skin, your real skin, and feeling strong, healthy, and confident at every age. Now for me, self-care means little rituals that support where I am right now, especially when it comes to skincare. My goal now is to look the best I can in my 50s, and that's why I'm obsessed with Strivectin's Peptide Plump Collagen Cushion Cream, and it's become such a staple in my routine. It's super easy to use, just one step, and it does a lot of the heavy lifting. It's powered by Strivectin's alpha-3 peptide technology, which supports collagen, elastin, and hyaluronic acid to help soften the look of lines and give your skin that healthy, rustic glow. It's got this amazing cushiony texture, and even though my mornings are chaos, it's one moment that feels intentional. And the best part, 97% of women in clinical studies said they'd choose this cream over injectable fillers after 4 weeks. It's that good. Whether you're maintaining results or you just want to support your skin as it changes, without adding stress or extra steps, Strivectin shows up for you, just like you show up for everyone else. Strivectin. Treat yourself, you deserve it. Discover the science behind great skin. When we shoot the podcast, we like to have a lot of snacks for everybody. The crew, me, Dr. A, our producers. But I've been really trying to cut out foods that aren't good for me and only eat the foods that make me feel good. But the other day, I had back-to-back meetings and no time for lunch. I was close to grabbing something not so good for me from the snack stash we have in the studio, until I remembered I had a David protein bar in my bag. It was a lifesaver. My schedule is nonstop. Early mornings, late nights, and somehow I still need to take care of myself. But let's be real, when you're juggling everything, prioritizing health can feel impossible. I've been keeping these on hand lately because they've become my go-to when I need something quick, satisfying, and actually supportive to my health goals. Each bar has 28 grams of protein, only 150 calories, and 0 sugar. And yes, they taste amazing. What really sold me is how clean and effective they are. Most bars are packed with sugar and fillers, but with David, 75% of the calories come from protein, which is unheard of. I've noticed I stay fuller longer, and it's been a huge help in keeping my nutrition on track, especially on busy days when everything else feels chaotic. Right now, David is giving SheMD listeners an exclusive offer. Buy 4 cartons, and you'll get the 5th one free at davidprotein.com/SheMD. That's davidprotein.com/SheMD and get your 5th carton free. Lately, I've been trying to push myself a little bit harder in my workouts. Nothing wild, just being more consistent. But I started noticing something. I'd feel great during the workout, and then I'd totally crash an hour later. Turns out I wasn't properly rehydrating. Water alone wasn't cutting it. Luckily for me, I recently added Cure Hydration to my routine, and the difference has been huge. Cure is a plant-based electrolyte mix made with clean ingredients like coconut water powder and pink Himalayan salt, and it's based on the World Health Organization's oral rehydration formula. It hydrates as effectively as an IV drip, but you just stir it into water. There's no added sugar, no artificial sweeteners, and it comes in really delicious flavors. Berry pomegranate is my current favorite, especially after a sweaty class of hot yoga. Whether you're doing a full workout or just trying to stay active and energized, Cure makes it easy to give your body what it actually needs. Water alone isn't enough to do that job. That's why you need to try Cure, the electrolyte drink mix that tastes as amazing as it makes you feel. For SheMD listeners, Cure is offering 20% off your first order. Stay hydrated and feel your best by visiting curehydration.com/SheMD and using promo code SheMD at checkout. That's curehydration.com/SheMD and use code SheMD for 20% off your first order. What about sunscreen? Can you be outside if you have 50? Are all sunscreens created equal?
And this is something I used to always call Susan Sweater is a very well-known international dermatologist up in Stanford. It's just to talk about it, and it was just used to go over my head, okay, that sunscreen at times is inadequate. And in the United States, sunscreens are not as effective as sunscreens that you buy outside in Europe. The last time a sunscreen formula was approved in the US was over 20 years ago, more, 90s.
Oh,
Okay. And when we have to work at that, that's not what I do, but it's something that I'm aware of.
right.
And that makes it even more important that we do this, that we wear sunscreen, reapply, utilize those behaviors that people in other countries use, like Australia. They don't send their kids out at the height of the sun. They all wear hats outside. They wear sunscreen. My children were raised wearing sun shirts,
Yeah.
swimming, hats when they're not in the water, things like that. Very important.
Is there a link between hormonal changes and melanoma risk?
Yes. It has to do with estrogen.
Okay, that's why I'm asking.
That's why there's a higher incidence in women.
Can immunotherapy be used in pregnancy? So if you have, one
Oh,
thing that happens in
yes.
pregnancy, your moles change.
They
I
go,
don't know if you
"Wow,"
remember.
yeah.
Yes, you can, So my question to you is, when you see these moles growing during pregnancy, do you biopsy it? Do you watch it? And if you diagnose melanoma during pregnancy, can you use immunotherapy while patients are pregnant?
So you would be surprised to know that I've taken care of 3 or 4 patients who have been either diagnosed
During pregnancy?
during, right before, or after. And this is a very difficult and rare situation that we just as a group published our experience with it. Pregnancy is an immune suppressed state
Correct.
because you have this foreign thing that half of it, not by your choice, comes from someone else. So your immune system is truly, truly suppressed. To the point that when I've had patients who've had very high risk melanomas, I counsel them against pregnancies. If you see moles change, yes, you should get them biopsied. You can make decisions based on the stage and where it's at. Can you use a CAT scan during pregnancy? No,
No.
but you can do MRI.
Right.
Okay. Can you go under anesthesia? Yes, somewhat, but you can use local blocks. If you have aggressive metastatic disease, can you receive therapy? Yes. There are some drugs that block a mutation that's found in 50% of melanomas. That's the BRAF gene. And those drugs, one of those drugs can be used. And we've done that. We utilize it to control disease to get a woman to
28 weeks.
28 weeks
Deliver.
and induced her in a controlled environment. The child was fine. What do you have to do there? The placenta needs to be sectioned and looked at because there is a lot of data of the rare transmission of those cells through the placenta.
That makes sense.
It does. And then you have to keep
And
an
if
eye
you
on the
find
child.
it in the placenta, then what?
You have to surveil the child
Starting at
initially
birth.
at
Wow.
birth. And it's happened. It's very much happened. And that's important.
Can you use immunotherapy
You can use an immunotherapy after delivery.
after delivery?
Yeah.
That's what I'm asking.
There have been case reports of immunotherapy that has been given to a person who has been unknowingly pregnant, but I would not recommend that.
Right.
Thaïs would know that there are other avenues to take that are beyond this discussion. That's where I think you need to find someone who really knows melanoma. So this is a point, it's a specific point. I think you'd ask me like, what would you say to a patient who has melanoma? Okay, well, melanoma is not very common throughout. Most oncologists take care of breast cancer, lung cancer, colorectal cancer, prostate cancer. And then melanoma is sort of like a boutique-y type of cancer. It is very common in young women. I think it's like the third most common. So what I recommend to patients is to seek an expert opinion. And if there is standard care that you can receive locally, receive that locally with the oversight of someone who has been there and has gone through these things. And when you reach forks in the road in decision making, return back to those doctors.
Okay. Like your team. They're your team.
They're your team.
Yeah.
You know, one of the biggest misconceptions around melanoma or skin cancer is that basal cell carcinoma comes from the sun, but melanoma comes from genetic predisposition. And I think one of the most important points in this podcast today is for all those people who constantly tan by the beach, my daughters included, and I want them to listen to this because I always fight. I'm always under an umbrella protecting myself, and they're just tanning. And I want them to really understand that, especially when you have a relative with melanoma, or if you don't, sun exposure does increase this risk, and it's
Absolutely. But guess what? We don't understand risk well.
Yeah, when you're
Right.
young, you think you're invincible. And here's this disease that's going to affect you more when you are young. This is a cancer that literally is going to come after you when you're
That's right.
young.
And I think the best way is to mitigate that risk by having the right type of habit. Now, listen, I'm a hypocrite. You're a hypocrite. You're a hypocrite. If that was true, we'd all cut out what?
My Diet Coke. I mean, all the stuff that I do. It's
Red
my wine.
meat.
Exactly.
Red meat, which has been linked to,
Yes, of course.
colorectal cancer, etc. So you have to try and mitigate your lifestyle, understand your risk, do those behaviors that are important. We get colonoscopies. I get a colonoscopy. You've had a colonoscopy?
I get a colonoscopy.
of course.
Right. And that's the same way as why we should be seeing a dermatologist,
Right.
why we should be doing skin checks, self-exams.
Absolutely.
So I want you to leave us with two things. If you could have the mic and tell every man, woman on this planet two things to do to prevent melanoma, what would it be?
Decrease your sun exposure.
Mhm.
That's the first thing.
Mhm.
Number 2, get your skin checked.
Good advice.
Those are very straightforward things. Most dermatologists I know are the smartest physicians. Why? Because it's so hard to become a dermatologist. I work with phenomenal dermatologists in this city and in other places who work extremely hard in order to prevent malignancies that can have a real bad outcome.
Thaïs always says that it drives her crazy because the well woman visit isn't just about a pap smear. It's doing it all. Well, your dermatologist appointment isn't just about your Botox. Like,
right. Good point.
get your skin checked. I mean, those are two things it's really important. And I don't do enough of it either.
I want to
And
just tell you, you have to be your own advocate. Be your own advocate. It's not everyone.
Theme of
who
this
is like that.
podcast.
In Europe, dermatologists do the diagnoses, they do the early surgeries, and they also give the immunotherapies.
Oh, wow.
They do. It's just in the States where we're not familiar with that.
I want to add genetic testing. I keep saying this. If you have family history of any cancers, take a genetic test. There's a specific one with Myriad called Molaris that checks for melanoma-related gene mutations. So these are available, covered by insurance. Be your own health advocate. Listen to this podcast. It was amazing.
Thank
You're
you.
incredible. I learned everything I wanted to learn about melanoma.
Well, it's
And-
mutual. And I enjoy this. This is the best part of my job is
You're
education.
incredible. No, you just educated.
I'm going to leave here and go and do something for the Melanoma Research Alliance. And it's a great point to make that there are a lot of people who are working and are available not only to scientists, but to patients. So Melanoma Research Alliance was started by Deborah Black and Mike Milken. A few people know Mike Milken lost his father to melanoma, and it funds a lot of education and a lot of basic science research. And at this time, you cannot underemphasize how important that is. I mentioned AIM at Melanoma, who was started by this lovely woman named Valerie Guild, who lost her daughter and decided to do something. And they're at the forefront of tanning bed legislation, education, the Melanoma Research Foundation. And they're led by a group of physicians, and their work is to bring collaborative institutions together. And the final one for me is that we never talked about ocular melanoma. It's a melanoma that has nothing to do with this, but starts in the eye. And Cure OM is trying to mimic all of that for ocular melanoma.
We also just really appreciate the women like Khloe and Teddy who are using their platform to really educate. There's so many women in this country that don't have access to the kind of doctors like you two. So I really appreciate you coming and being very clear and concise on what we can do for prevention, what you can do if you have melanoma. So I just thank you.
I appreciate the ability to just really talk about what really excites me and moves me in this field. Thank you.
Thanks so much for joining us today on SheMD.
If you want to own your own health, a good place to start is by following us on social media at SheMD Podcast and by subscribing to our show on YouTube or wherever you get your podcasts.
For takeaways from today's episode, visit our website, shemdpodcast.com. We'll see you next time on SheMD. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SheMD, some of the products and services we discuss may involve sponsorships or paid advertising.